Everything looks crystal clear. The lens is beautifully inside the bag here. Troy, any pain at all?
Yes, sir.
Beautiful. And for doctors watching, this is, as usual, our patients with no anesthesia, not even sedation. And I'm inside their eye and we are talking as we are doing these complex cases and maneuvering. Troy, how would you rate your experience here? You're back for your second eye.
Better than the first. It's awesome.
Well, how do you feel?
Feel awesome. Second surgery.
Second eye, yes.
Yep.
Yes.
She did my wife. She's 16 years ago and it's still good to go. So that's why I trust this man for life.
So much. How was your experience in the suite here?
Amazing.
You've had
Wonderful.
no drugs, you've had no anesthesia, just numbing drops, and we were in your eye. How do you feel?
I feel great. Like I said, I prep by going to the dentist beforehand. I feel uncomfortable, really uncomfortable with the drill in my mouth. So this was a cakewalk compared to the dentist. Right.
Hi, my name is Troy DeVries. This is my story about Dr. Gulani. I was having a lot of problems with my wife. I've been to just about every specialist here in Jacksonville. They thought she had MS, they thought she had a brain tumor, they thought she had cancer, a lot of things they couldn't diagnose, so we just went from specialist to specialist to specialist. Finally, somebody recommended going to Dr. Gulani, an eye doctor, and I'm like, I don't know what that has to do with anything. So we went and saw him, and within 5 minutes, he diagnosed everything that was wrong with her, did the surgery 14 years ago, and she's been good to go with great vision in her one eye ever since. She went from 20/20 vision to 2600 in a 3-month period, so she really declined fast. This is why nobody could figure out what was wrong with her, and he did it in 5 minutes. So the man is amazing. He's an impeccable dresser. So when my eyes started going bad, I was very excited when I got back and found out he was still practicing down in Jacksonville. So with my history, I was military, law enforcement. I've in the military took hundreds and hundreds of way too many close explosive charges, a lot of overpressure, damage to my brain, a lot of little mini concussions here and there, a lot of wear and tear on it. So he looked at me and there was a lot of trauma in both eyes, and he really took care of my surgery. He put a lot of effort, came in on Sunday, came up with a good surgery plan for both eyes, and he did them 2 weeks apart, and I've been very happy with how it came out. There was no pain. He talked me through the second surgery. He had some interns in there, which I was a little like, I was not too happy about it until he got in there, and actually him explaining the entire surgical process through what he was doing actually kind of made me more at ease, and it was kind of nice to know every step he was doing and how intrinsic the surgery really, really was. Most of these are a couple minutes long. His was almost 20 minutes long. That's how much he had to do inside there. So I really do appreciate everything he's done for me, and just can't say enough for Dr. Gulani. I recommend him to everybody. I do want to bring my parents down here to get looked at, and I've already talked them up with a bunch of people that already want to make appointments with him. So I'm very happy. So thank you. The day of the surgery, he has his own surgical facility here on site, which was nice. When my wife did it 14 years ago, this wasn't open yet, so we went to the hospital, and there's just a ton of other people there. It was chaotic. But this, they walk you over to the surgery center. You're the only person in there. I'm going to say I got LaZrPlastique surgery now before, for really long word. But it was done in both eyes, cataract, glaucoma, and some other damage, some astigmatism. The surgery center is state of the art. It's beautiful. You're the only person in there. You're at ease. They walk you into the surgery. They walk you out to your wife. You take it from your wife when you get in. So it's very. I've never had surgery before where I was actually able to talk to a doctor afterwards, where he walks you out, sits with you, listens to your needs. Cannot say enough about the man. He's awesome. So thank you again.